For the past 7 months, there has been an acute shortage of drugs at the Bartica Regional Hospital, which serves the entire population of Region 7. This is according to the Vice Chairman of Region 7, Amel Griffith. Prasad, who made the glaring revelation during an interview with Nightly News, recently pushed for the situation to be addressed and rectified immediately. The vice chairman lamented that the current situation could result in many detrimental effects not only to patients but the healthcare workers if the situation is left unaddressed.
We are also faced with a crisis at our regional hospital where there is a shortage of drugs. This has been ongoing for a couple of months, and our healthcare workers are under tremendous strain.
While highlighting the crisis, the vice chairman applauded the medical staff of the hospital who have been leading the fight against the threat of the novel coronavirus and other ailments despite the challenges. When the drug shortage claim was put forward to the Minister of Health, Dr. Frank Anthony, on Tuesday, he seemingly downplayed the severity of the situation on the functionality and operation of the hospital, its staff, and further, the possible adverse effects on patients seeking treatment. He, however, admitted that there has been a shortage, but stated that the situation is far from a major crisis.
Well, I'm not aware of a major drug shortage. Major sounds like if there are a lot of things that are short. We do have some shortages, and as you know, we have constantly explained this. We inherited a bad situation with medicines, and we have been working to fix that.
According to Minister Anthony, the shortage of drugs could be traced back to the $10 billion worth of expired drugs which the government was forced to dump. He stated that while a few items are short at the Bartica Hospital, government is working to procure those items to distribute to the various regions. He stated that in Region 1, all of the essential medicines are in place. He opined that in Region 7, the situation is likely to be the same.
While they were making the assessment of what expired, they also did an assessment of how many drugs and medical supplies they currently have in the system, and it far exceeds what was expired. So I know for sure, based on that audit, that we have a lot of medicines in Region 7.
In March, Minister Anthony announced that as government continues to address issues in the health sector, $12 billion was spent on procuring medication. He claimed that approximately $4 billion was spent on acquiring essential medication, while another $5 billion went towards personal protective equipment and $3 billion was used to purchase reagents for laboratories. Meanwhile, the Region 7 Vice Chairman stated that the Regional Executive Officer, as well as other local authorities, had previously lobbied for the drug shortage situation to be addressed. Amel maintained that the situation must be rectified expeditiously.
There were a little bit of changes due to the region administration stepping in, and but moving forward, we cannot continue along that line. There is a need for a lot more to be done when it comes to our healthcare system.
Reporting for the HTP Nightly News, Amel Griffith.